approach. So it is clear that this is the ideal situation for the use of the heat-treated blue light patch file. And this is the preoperative radiograph, and this is the post-operative radiograph with the MB2. The finisher files are used once completed the shaping with the Eastay Gold 2505 every time the canal is bigger than 25. And the main characteristic of this file is that are extremely flexible, so with no risk of foramen transportation during the finishing of the canal. This is the first finisher file, is a 3504, and always the cross-section of all the finisher is a convex triangle cross-section, because we want a file that works extremely centered in the canal for the finishing. And as you can see, the maximum diameter is 0.8. If the foramen is bigger than 35, we can move to the 4503% with the same characteristic. And if it is even bigger than 45, you can move to the 6003. 60 is a big size that we felt the lack of this size, honestly, in our practice. That's why, rather than stop to 50, as most of brand, we decided to design a 60, and it's honestly is really useful in the clinical practice. Let's see quickly the protocol. So the shaping always begin with a. You have the double option. You are a conventional shaping user, so you love to scalp the canal before with the file, with a manual file. So you can do it, of course. So there are no restrictions regarding this kit. If you are a lover of a full mechanical shaping, so basically you limited the use of the manual file just to the working length registration. So you do start immediately with a glide pipe file. Of course, in this step of preferring, the file is not engaged completely in the canal. You have not to arrive to the working length, but basically you are just creating a preliminary enlargement for the proper use and the safe use of the orifice opener, and then of all the rest of the file of the sequence. This is a case I did. It is a molar with a nice anatomy. So this is the opener. So I can visually check that the flutes are 6 millimeters inside the canal. Another advantage of the gold treatment, especially in this posterior teeth, is that you can bend the file in order to ease the insertion of the file. So after the glide path, you have to arrive at the working length with the other file, and it's done. This is the yellow. As you can see, is shaping because the canal are really narrow. And this is the last file of the gold kit. It is a 2505. And even here is not a single stroke to the working length, but is a sweet approach. And as you can see, the blades at tip level are dirty, so I can move forward with the final rinse protocol with activation, and this is then the obturation of the canal. So the option we have for the full mechanical shaping is just regarding to replace the glide path file gold with the blue when we work in extremely contracted cavities, or as in the case of Fabio, when you want to start the negotiation of the canal without removing the coronal interferences. And then how to decide when we can stop to 2505 or to move to the finishers. There are no secrets for that. What we are doing for a long time is to use the so-called visual gauging. It means that if the blades of the 2505 are clean after the shaping, it means that the file didn't print its shape on the canal, didn't touch the canal in the apical thread. So I move to the 3504. Then I check the fluids of the 3504. If are dirty, I can move for the obturation, or if are clean, of course, I have to increase the diameter. If I want to create a continuous taper at the apical thread, that is really important, of course, for the obturation. Just go deep, just to show you why these files are so different from each other and why we selected these sizes. And I just want to start after the sculpting or the preferring, as you prefer. After the proper use of the opener, we registered the working length and we created the glide path. And when we reached this point, so basically we are sure to have these sizes inside the canal. From D0 to D11 are the sizes of the glide path file that arrive to the working length. And in the first 6 millimeters of the canal are the sizes of the orifice opener. Now, in this space, I have to use the shaping 17 variable taper. 17 at the tip, with the taper is 4, 5, and 6%. And when you will use this file, the feeling is that the file can arrive deep very easily. So the question could be why it looks like it's not working. So maybe you can have an idea, I can skip this file. We have to follow the sequence because this file basically can arrive so deep because the previous file worked well and it has to work to prepare the road for the finishing file. It's a work team. So we cannot skip the sequence. Otherwise, it means that we charge with more stress one file, and then we can have some problem as unwinding of the blades or breakages and so on. So basically, the file at 5 millimeters is not engaged, and as you can see in this scheme, at 4 millimeters, if you feel a resistance, this resistance can arise not from the tip, but from the central part of the file. And basically, we are in this situation up to 2 millimeters from the working length. This is extremely important because it means that from 5 to 2 millimeters, if I feel a resistance to the file, I can force the file because there is no, because I'm sure that the tip is not engaged. The tip is acting as a pilot tip inside the canal, as a pilot guide. So I can force against the resistance, sure that the tip is not engaged, so sure that I can have, I won't have any problem in terms of unwinding of the tip, in terms of taper lock fracture, in terms of ledge creation. And this file will work at apical level just in the last 2 millimeters. So I insert the file, I can force up to 2 millimeters, and then, of course, I have to pay a little bit more attention because this is a shaping file. It has to shape the apical thread. So this is normal. And now, after the use of the 17, I created a new space in the canal with the sizes of the 17 and of the orifice opener. And in this space will work the 2505. And the 2505 can arrive at 3 millimeters from the working length without touching the canal wall. And this is a great advantage because it means that we are going to stress the file just in the last 3 millimeters of the shaping. And it means that we are preserving the stress on the file. So If you are a single user, I think it is super happy. But if you want to reuse the file in more cases, you have to control the stress on the file. Otherwise, the more you use, the higher is the risk to get some problem. At 2 millimeter, the file starts working in the central part, but the tip is always free, is acting as a pilot guide in the canal. And so even here, you have no risk to get any kind of unwinding or any kind of taper lock fracture. And the file is designed so to work just in the last 2 millimeter of the canal. I think this scheme were really clear to understand why we need 4-file to complete safely the shaping, especially if we want to reuse the file, because in this way we can divide the effort of the shaping among more file. It's a work team. Every file prepare the road for the next file in the sequence, and if the road is well prepared, we can reach our goal of a very nice shaping, a feasible, repeatable, and teachable shaping in most of the cases. This is the typical wisdom tooth, extracted wisdom tooth, with a strong curvature, so it's a good test for this file. And here you can see the orifice opener that works in the first 6 millimeter of the canal. If you did the scouting before, or if you went with the pre-flaring before, the tip is not engaged, so there is no risk to create any kind of problem. And as the flutes stop at 6 millimeter, the file is not subject to skewing effect, so there is no risk that the file go deeper than 6 millimeter inside the canal, so it's really safe. So now I can register my working length. From the working length registration, you can see how curved is this canal. This is the glide path file at the working length. And this is the 17 variable taper at the working length. And this is the 2505 at the working length. So no problem during the shaping. And so now I can check the flutes of my 2505. And if the flutes are dirty, I can place my GP point and I can move forward to the obturation. If are not dirty, according with the visual gauging concept, I do increase the diameter of the apical third of my shaping. So I move to the Eastside blue. And the Eastside blue, just to show you the concept of the Eastside blue, the 3504 that works in the space created by the 2505, as you can see, even this works just in the last 2 millimeter. So even in here, the stress is really controlled. So no risk, is completely free at 2 millimeter, and then it starts working in the last 2 millimeter, but just basically in the apical third and a little bit in the middle third if the canal is really narrow. And this wisdom tooth was a very good stress test even for the blue file. This is the 3504 at working length. And I was honestly surprised because, as you can see, the file is centered and the file shaped this canal without any kind of problem. So now let's imagine that 3504 is not enough because the flutes are clean. So I do move to the 4503. And the 4503 is working in the space created by the previous file. And this file, up to 3 millimeter from the working length, is completely not engaged. So it is not like a sword inside the canal. So here the diameter are super controlled. The sizes were studied very well in order that the file can work in the last millimeter of the file and the last millimeter of the canal. And I was surprised even about the flexibility of the 4503. So as you can see, the 4503 is at the working length. The canal is always centered. You cannot see any kind of transportation, and this is thanks to the heat treatment, of course, and it's thanks even to the cross section. So now let's imagine that even 4503 is not enough, of course. We do move to the 6003, always with a blue treatment. This is a nice case from Ricardo, a retreatment of this central incisor, maxillary incisor. As you can see, the 6003 can arrive to the working length, and then there is even a very ideal control of the obturation material, even though the 60 is a big foramen, so it's not easy to control the material during the obturation. But what was surprising about this file is the flexibility again. This is the 6003 in this wisdom tooth. And look at, there is no problem, it's always centered, extremely flexible. So it's, I love this file, honestly, because it gives me more options. Another benefit of the E-Style Gold kit is that is the ideal sequence when it comes to manage ledge, and if we want to manage ledge with rotary files. I show you this video very quickly. So how to manage the ledge? The first thing to do is to measure the depth of the ledge. So in this case, the depth is 15. So now the second step is to pre-enlarge the canal coronary to the ledge. And we have a very nice file to do that, the Opener 250 13% taper that works in the first 6 millimeter. And of course, you shape, you clean. And then what I have to do is I bend a manual file in order to overcome the ledge, and I place the rubber lamp stop at 1 millimeter plus the depth of the ledge. So if the rubber lamp stop arrives to the bending point, it means that the tip of the file overcame the ledge. And when it happens, I don't push immediately the file to the working length, but I start with this in-out movement in order to smooth the ledge. And I repeat this movement even with 15. Without forcing the file to the working length. I'm just working 1 millimeter behind the ledge. And then if I want, even with a 20. So now it's time to register the working length with the apex locator. The working length is 18 in this case. And now for me, it's easy to understand if there is enough space. Of course, there is, because if a 20 would come over the ledge, it means that the diameter of the canal over the ledge is at least 20, right? So in this case, if I want, I can do some calculation. I know the ledge is a 15, a 10 arrived to the working length. So I know that the minimum space I have at least 16 millimeter in the canal behind the ledge. As the file I'm going to use now is 12.5, so the tip can overcome without any problem. So I place the rubber stop at the working length. I bend the tip of my 12.5, my glide path file, and then I insert manually, and then I connect the head of the engine to the file. I arrive to the working length, and I even do this in-out movement in order to smooth the ledge again. And then I repeat this action with a 17 variable taper. What is the advantage of this kit? As it is God heat treated, you bend the file out of the mouth of the patient, and when you insert in the canal at body temperature, the file remains bent. So, for example, you cannot do that with a blue heat treated file, because a blue heat treated file, when you insert the canal, become to a straight shape, so cannot overcome the ledge. After the 17 variable taper, I check again the working length with the 20, but this time the 20 is not bent, because if the 20 can arrive to the working length, so there is no need to bend the 25, and the 25 can enter. I can bend the 25 if I want, but if the 20 can arrive without bending the 20, so there is no need to bend the 25. And then I can complete my shape. So that was quickly the concept of the E-style. And now we are open for the discussion if you have any question. And of course, as Riccardo already told you, we are preparing more video, we are preparing more presentation to explain even better the concept of this system. Any question?
Great presentation, Filippo, as usual. I think that this kit can really satisfy all the users around the world, in my opinion, because around the world we met many people with different habits on apical shaping, cross sections, and so we mixed up everything in order to satisfy them properly. So in my opinion, the most important thing, as you said, is that we will deliver just one message around the world, and these two kits can enter in our daily practice in a proper way. And if they will respect the sequence, of course, they will be satisfied 100%. I don't know if you want to add something, Fabio, or if someone of you guys has questions.
You guys explain everything about the sequence, about the features of the kit. My impression using this file, that everything is easy, really easy. Thanks to the different cross sections, thanks to the different tapering and the design of the instrument. So that's why, as Filippo said, if you are a fully mechanical instrumentation user, you can reach your goal easily. If you want to use hands before, it's fine. So we have different options, and that's why, in my opinion, is a really good kit.
There is a question about the heat treatments. As already explained in the presentation, the two kits have a different heat treatment. The God E-style God has a God heat treatment, of course, because during the shaping we need something that is flexible, but at the same time not too much flexible, because of course, especially when it comes to narrow canal, we do a little bit, the file has to be a little bit stiff, okay? On the other end, when it comes to the finisher file that are really big, we need extremely flexibility. That's why for the finisher file. The heat treatment is the blue one, and as you already seen in the wisdom extracted tooth, the flexibility and the centerability of this file, even of the 6003, is super good. Regarding how to procure the file, you have many options. So you can use a plier from that you are using for orthodontics or the conventional plier. You can use your finger, so the bending of the file is not a problem. And I think there are no other questions.
Oh.
Someone are in the airport.
Yeah.
Hey guys, if you have any questions, please leave the message on the chat, please. Let's take
I think the use of this file is really easy because the sequence is super logical, and it is not a sequence that obliges the user to change the shaping habit. So you are a full mechanical shaping lover, no problem. You love to scout the canal with 08K file, 10K file, no problem. What is extremely important is to use properly the file. So the opener has to work 6 millimeter. If it works 5, it means that the glide path file and the other file, they will do the job that the opener didn't, so are more stressed. The glide path file has to arrive to the working length. If we stop 1 millimeter shorter, so it means that the yellow one won't start shaping at 4 millimeter, but it will start shaping before, so it will be more stressed. So this is extremely important. You can ease your shaping, but you do use properly the file, and to use properly this file is honestly super easy. And this is the idea behind this file, in order to allow everybody to get a repeatable result during the shaping. And when we say repeatable, beautiful, the result during the shaping. I think that if some people watching the registration have some other question, maybe even later, can send the question to ATIT, and ATIT will share the question with us, and we'll reply very, very soon. It's okay?
Yes, Dr. Filippo. Guys, if you have more questions later, please leave the message on AT's like Facebook or Instagram. We're gonna collect all the questions and give you the answers. All right, Doctor. I think I think
We're finished.
Yeah, I think it's all we have the time for today.
Perfect.
All right. Thank you, Doctor. Thanks for your presentation. And also, thanks for all of you, our wonderful dental community. Thank you for your engagement. We hope you find this e-style session valuable. Thanks for your joining us, and have a fantastic rest of your day. We will see you next time. Thank you. Thank you, Dr.
Thank you so much.
Thank you, Dr.
Thank you.
Bye-bye.
Bye.
Bye. Bye-bye.
Recording stopped.